Well, good morning and welcome to Living Well and a little COVID update again. I appreciate being asked back for my third time back here at Living Well to give you guys a COVID update. For those of you who don't know me or haven't joined in the past, my name is Kevin Most. I'm the Vice President of Medical Affairs and the Chief Medical Officer at Central DuPage. And I've had the opportunity to speak on COVID in numerous places. So hopefully I'm going to be able to answer a lot of the questions that you have and kind of give you some information and see where we're headed. I know there's a lot of frustration out there right now, and I'd like to start out with some optimism instead of frustration. So optimistically, what's going on right now? Well, if you look at the entire country, we certainly are seeing COVID numbers plummeting. If you look locally in the state of Illinois, we're down, in the 3%, which is outstanding. And it just shows that all the mitigation efforts that you are doing, as well as all of us are doing, are actually working well. Hospitalizations are well down. I can tell you we had a high of about 130 in December and early January. And as of early last week, we were down into the teens. We've crept up a little bit, but we're doing much better. So when you look at that and then you look at the vaccinations, which I know is a hot topic and we'll touch on all of those, I just wanted to say that we are looking very optimistically of what the future holds for us. Before I get started, I do want to let you know I'm glad for those of you who are participating with all of Living Well's programs that they're doing virtually. I can tell you that the staff here misses you, but is so appreciative of everybody that's joining and is being able to do the virtual classes. And I think that they're looking at this saying, you know what, we may do virtual as well going forward, but when we get to a point where enough people are vaccinated and we feel safe, they certainly want to have you back here because they know the importance of you being in person for some events. So on behalf of all the staff at Living Well, we appreciate everything you're doing to mitigate this illness and as well as interacting with many of your peers and your friends. You may get a lot out of the Living Well interactions. I can tell you that many of the others that are on the Zoom calls or the Teams calls with you are getting a lot out of it as well, just from your interactions. So please continue to do that. So let's talk a little bit about the virus and where we stand right now. Obviously, probably one of the biggest things that everyone is concerned about is the variants. And we all have to realize that variants happen all the time in viruses. Viruses mutate and change continually. The ones that we are concerned about are the variants that have actually gained some foothold. And for those of you who remember science back in school, Darwinism, the survival of the fittest. And that's what actually happens with variants. The variants that are surviving now are those that can spread easier. So when you look at the UK variant or the South African variant or the Brazilian variant or the Japan variant, each of them you will hear over and over is more contagious. That by definition is Darwinism, and that is why they survive and that is why they have spread. They've been around a lot longer than people might think. These are not variants that have been around for a month or two. We knew about some of these back in October and November. By that time, however, the vaccine was well into production and a change really couldn't be made. So we look now at the vaccines and say, okay, are the vaccines going to work against the variants? It's probably everyone's biggest question right now. And we can tell you that the AstraZeneca vaccine, which has not been approved here in the United States, does not appear to do well against the South African variant, but does well against the novel virus that we initially had, as well as the UK virus. And you might have read last week that the World Health Organization made an EUA, emergency use authorization, for AstraZeneca to be used essentially worldwide. Has not hit that point in the United States yet. We are still with the two gold standards that we have right now, the Pfizer and the Moderna vaccines. Now, I know many of you are frustrated about not being able to get a vaccine. We're going to talk a little bit about that. But let's first talk about just the vaccines themselves and why we're having a little bit of problem. Number one, we have two companies that are making it, obviously, Moderna and Pfizer. Johnson & Johnson, I was hoping that we could, by the time we started talking today, that we'd say that it was approved. It looks like it'll probably end up being later this week. So with Johnson & Johnson being added to the mix, there's two others out there. Obviously the AstraZeneca, which we were hoping to be the first vaccine here, and Novavax. But those are right around the corner, and we really expect them to be approved either in late March or April. So to put that in perspective, instead of having 2 vaccine manufacturers, we will go to 5 vaccine manufacturers. Johnson & Johnson alone has 7 plants in the United States that will be ready to produce about 110 million doses within a very short period of time. The expectation is that we're going to have well north of 300 million doses come May or June. So, if you put that in perspective, we will have enough vaccine to vaccinate everyone in the United States by the middle of June, late June, early July. So really, we want to make sure that everyone understands the vaccine is coming. I know the frustration is there because you can't get it now, but look at what we've done just with the mitigation efforts that we've done. We're all wearing masks. I'm not wearing a mask right now so that you can hear me clearly. My colleagues in the room are well more than 6 feet away from me, so we're being very safe here. But look at what we've done with the mitigation of physically distancing when appropriate, wearing masks, washing our hands, doing all those things. We have knocked this virus down. Right now, it's time for us to really step on it a little bit more with the vaccines, which will hopefully get us back to a point of somewhat normalcy come late summer, early fall. So I know many of you are saying, well, which vaccine should I get? Moderna and Pfizer's have rates of 99% effectiveness, and yet Johnson & Johnson, the one we're all waiting for, has effectiveness in the United States of about 72%. Should I get one of the Moderna or Pfizer, or should I get Johnson & Johnson? I will tell you, get the vaccine as quickly as you can, wherever you can. Don't wait for a specific manufacturer. I will also tell you that Johnson & Johnson is doing a study for a second shot as well, and we expect that if they do come through with the second shot, they will be in the 90% as well. So please, when you have the opportunity to, get the vaccine when you can. So I know many of you had questions about, are the vaccines safe in cancer patients? And let me caveat all of this by saying these discussions really should be held with your oncologist. I don't want the oncologist to say, what is Dr. Most telling you all? But I will tell you what is known nationally. The NCCN guidelines are really showing that anyone undergoing therapy for a solid tumor should get the vaccine as soon as it's available to them, whatever age group and demographic they fall into. Those patients who are leukemic patients, who have gotten stem cell or bone marrow transplants, really it's going to be based on where your white blood cell count is. And it should be a discussion you're having with your oncologist around the timing of that. We do know that the response rate in many patients who are receiving chemotherapy may not be as high as the 94% we're seeing in the public. But again, we're going to do this to not only protect you, but to protect your family and protect everyone else. So even though there may be a decreased rate of effectiveness in individuals with solid tumors receiving chemotherapy, you should still get the vaccine when possible. Someone asked a question about the messenger RNA vaccine. Does that help in cancer patients? The COVID vaccine is a messenger RNA vaccine. Does that COVID vaccine help cancer patients? Not really. But I will tell you that all the studies and everything that's being done on messenger RNA vaccines will certainly be helping cancer patients in the future. We'll go to a normal influenza virus vaccine. An influenza vaccine, we normally take a dead portion of the virus and teach the body how to look for that and to identify what the virus looks for so that it can be effective. In messenger RNA, it's not quite like that at all. Matter of fact, we don't use any portion of the COVID virus in the vaccine. We teach the body what to look for. We teach the messenger RNA to look, this is what we want you to produce, and then that is going to make the immune response. And that is where you will start to see more and more immunotherapy for cancer patients in the future, because we are learning so much about not only how to make the messenger RNA vaccines, but now how quickly we can and the number of plants and production areas that will be using messenger RNA technology. So cancer patients, you started the immunotherapy portion of this, and now with this virus, we have really expanded the messenger RNA, and the impact of it in the future is going to be unbelievable. So thank you for being the individuals who first tried this, those of you who perhaps have melanoma, and had vaccine treatments for your disease. This is what's going to allow us to advance the cancer treatments here. Let me see. I'm going to go to some of the questions that many of you had before, and we'll see how we're doing here. Has there been much study with cancer patients currently on chemo that have received the vaccine? Not as big as we had wanted. Initially, what they really wanted to do was to make sure that they could get this vaccine to market. So they took patients that were fairly healthy, I will say. As they advanced to phase 3, they certainly added patients with comorbidities, whether it is cancer, whether it was heart disease, whether it was diabetes. So they did get a good foundation of individuals with comorbidities and showed that it worked. Now, if you think about that, the vaccines that we're talking about with 94-95% effective rate actually had cancer patients and other patients that are immunocompromised in the study that may have pulled those results down even a little bit more. So really, we should be looking at that and going, these vaccines are exactly what we want. Everybody probably heard the governor allowing us in Illinois to go to what we call 1C. 1C patients being those between the ages of 16 and 64 with comorbidities. And it's actually very good news that he did it, but let me tell you the rate limiting step here. I'll tell you just in DuPage County where I happen to practice. In DuPage County, we have 96 sites ready to give the vaccine. Last week, we all put in our orders, and we ordered 52,000 doses of the vaccine for the week. DuPage County was allotted 4,500. So less than 10% of what we could deliver in people's arms was distributed to us. So this is not, and people are frustrated saying, I'm trying, why hasn't Northwestern done more? Why hasn't whoever done more? We are doing everything we can with the vaccines that we are giving. So I know that the frustration level is there, but I can assure you that we are ready to do this. Our clinics are set up. We are very efficient. We have a vaccine clinic today that filled very, very quickly, but we're going to do 1,000 vaccinations today in a very short period of time. So those of you who are frustrated, I understand your frustration. Those of you who now fall into that 16 to 64 age group with comorbidities and are looking for slots, I understand your frustration. It will allow us, as soon as we have supply, to extend it to everyone. But I can tell you that many health systems, including Northwestern, are doing this in a very organized way. You don't see, like you saw in Florida, where people are sitting in lawn chairs in the street waiting. We actually did this where we took the people at the highest risk and those people who are at high risk in vulnerable communities. And that's how we started doing this. And we're now starting to pare down and go down and work down. We hope to open to the 1C group very soon. And even that, we will look at the individual who has multiple comorbidities. The ones we're trying to protect will be the first ones. The individuals who then get down into just a single comorbidity but maybe fall into that 1C, you will still get it before the general population, but we're going to do this to protect people. Everyone has to remember that the vaccine, what it's doing is protecting you from getting advanced symptoms. So it's protecting you from getting in the hospital. It's protecting you from going into pneumonia. So that's our goal. So we really are trying to focus to make sure that we're doing this for the right populations at the right timing. And please, I know you're frustrated, but understand that within a short period of time, there will be plenty of vaccine for everyone. Is it safe to get my vaccine? I'm 72 years old and 95 days out after having COVID. My case was not severe, but for 10 days I did have constant temperatures over 100. Yes. There's very interesting things coming out right now, and depending on when you get the vaccine. Individuals who have had COVID do very well with the vaccine. As a matter of fact, they get about 10 times the response that we're getting from those who did not have COVID. So we're actually looking at individuals with, after the first shot too. So actually what we're looking at is individuals with COVID, and a large study is going on right now to see if they actually need 2 vaccines. They may only need 1 shot, which would be wonderful, because then that's going to obviously free up other shots for us. And may that be the Johnson & Johnson? It may be, but it may be any vaccine that, again, that you can get. So we look at about 90 days. We're asking people that have had COVID to wait 3 months post their infection before they get vaccinated. Because you will, we know, have natural immunity at high levels for at least 3 months. And then when given the booster, you will be in a much better shape. What is the procedure for notifying active patients when they're eligible? For those of you who are Northwestern patients, and for those of you who aren't, but maybe with DuPage Medical Group, or maybe with Advocate, hopefully you've all signed up for MyChart. MyChart is the tool that they're using to push out responses and pushing out invitations. And someone's asking, well, why can't I set an invitation? Why can't I go out a few weeks? Why can't I go out a few months from now? I know I'm going to be in Florida, but I'm going to be back in May. I'd like to take a time in May. Well, the reason is, again, I'm going back to my comments before. We had requests for 52,000 vaccines last week in DuPage County and got 4,500. So you can imagine if we said, oh, let's start putting clinics out 3 months from now or 2 months from now, and if we don't have the vaccine, the disappointment that you will have and the opportunity that you may have missed to take a vaccine earlier. So again, please, any time that you have the opportunity to take the vaccine, take it. And as we go further down the road, we certainly will have more opportunities to do it. I'm on chemotherapy. Do I qualify to get the vaccine? Yes. Even if you're on chemotherapy, you may want to check with your physician. But we certainly, if it's a solid tumor cancer and you're receiving treatment, we certainly want to make sure that you are vaccinated when appropriate. Now, your doctor may say, hey, during your treatment, your white blood cell count goes down quite a bit. We want to make sure that we're doing it at the appropriate time. But know that the NCCN is really pushing to get you, the individuals who have these comorbidities and are more vulnerable, vaccinated as soon as possible, even knowing that you may not get the complete response that we're seeing elsewhere.
Dr. Most, regarding that, can you talk a little bit about the caregivers for the cancer patients? Mm-hmm. There's been a couple questions that have come up that, although they're not quote-unquote healthcare workers or frontline workers,
yep,
they perceive themselves as such.
Absolutely.
Because of their engagement with their loved one. And so can you talk a little bit about that?
Yes. So I'm not sure if you could hear the question. The question was more about caregivers and those caring for individuals that may not be deemed to be healthcare workers, but yet they are caregivers for the vulnerable population. And absolutely that we want to get them in as quickly as possible. There's a problem. We can't identify you as a caregiver. So really what we need to do is have a better database and have more ability to identify the caregivers for individuals. If you're a hospice nurse, we've identified you. If you're a home health care nurse, you've been identified. But for the loved one who happens to be taking care of somebody who is vulnerable, we haven't been able to identify you. We have to figure out how to do that to make sure that you are getting that vaccine prior to the general population. We know that once your loved one or whoever you're caring for is vaccinated, their protection is pretty good, but we also want to know that they could still be asymptomatic carriers and give it back to you. So I would say to all the caregivers, please be patient. We know it's an issue. We're trying to figure out how to identify you to make sure that we get you in line the right way. And then also continue to use all the mitigation that you've used so far that has worked so well that you've used to protect the loved one that you're caring for. So please continue to do that.
And thank you, because I think you answered another question that came through just about the most recent information on whether those who've been vaccinated can still transmit the virus.
Yes. So the question is, those who've been vaccinated, can they continue to transmit the virus? When Pfizer and Moderna went to market, when they did their clinical trial, they left that out. And there was reasons why. Just the scope of trying to test 50,000 people on a regular basis to see if they were carriers, not knowing whether they got the placebo or the vaccine, was deemed not to be appropriate. I don't know if any of you have had a COVID test. They're not the most comfortable test to have. And to test somebody on a regular basis would have been very difficult for the 50,000 people. I can tell you right now that AstraZeneca did do that study, and Moderna and Pfizer are doing it right now. And it appears very, very promising that those who are vaccinated will not be carriers either. So that is really promising, because that will get us to the point where when we hit the vaccination number, we eventually can lose the masks as well. And I can tell you, I know that many of you who care for people know the importance of that reassuring smile to that cancer patient, or that cancer patient seeing a smiling face, or the cancer patient alone smiling and letting their loved one know that they're doing well. So we're going to really continue to study that and hope that it pans out the way it's looking right now, that even after vaccination you would not be an asymptomatic carrier. We don't know it yet, but it certainly looks promising.
And a question came up regarding a cancer patient who has had lymph nodes removed and just has a history of having a reaction to shots, including flu shots.
Yep.
And so would this vaccine be safe?
Okay. So the question is about lymph nodes being removed, and is the vaccine safe? Absolutely. We have to remember that we have T cells. Those are the cells that are B cells and T cells that make up antibodies that fight off infections. So we certainly know that removing some lymph nodes is not going to remove all your B and T cells. You still are able to fight off pneumonias. You're still able to fight off the common cold. Now, that being said, individuals who have had reactions, you may want to talk to your oncologist. He may not want you to get that vaccine in your arm because of potential surgery issues that you had with lymph nodes in the arm. So in that case, he may want you to get the vaccine in your thigh, as we do to young children. Really, our goal for the vaccine is to put it in a place where it has great blood supply, and it's into a muscle. That's why we have muscle arm pain after getting the vaccine. We don't want to give it subcutaneously, in other words, just barely under the skin, like those of you who have diabetes. That's how we give insulin. We need this to get into the bloodstream so that the immune system gets into it and recognizes it and starts to work on making antibodies. So those of you who had surgery, if there's a restriction in your arm, certainly talk to your doctor and ask them if you should be getting it in your thigh instead of your arm.
Dr. Most, last time you were here and presented, you talked about antibody testing that was being offered at CDH. Can you share if that's still going on, and if people are interested, what is the best way to go ahead and schedule something like that?
Certainly. Yes, the question is, are we still doing antibody testing? And if we are, how can we do that, and how can we sign up for it? Your physician can offer antibody testing to you. And let's just talk a little bit briefly about antibody testing. Antibody testing is a blood test that shows whether or not you were exposed to COVID. Antibodies will wane as you get further out and away from it, and you might have all seen Tom Hanks' wife. I'm trying to think of her name, Rita Wilson. She made a big deal about, oh my gosh, my antibodies are gone after they both had come down with COVID months and months and months ago. And that was disturbing. I wish she would have counseled somebody, because even though the antibodies may have not been measured in the bloodstream, we certainly have T cells that are out there that will remember it and will start to produce antibody when needed. Antibodies will wane as not needed, but we have these T memory cells that will make antibodies if we get re-exposed to the virus. So the reason for antibody testing is, did I have this in the past? even for individuals who have had it in the past, we're going to tell you to get vaccinated. So what we were looking for prior to that was, do you have some natural immunity, and can we push back your vaccination a little bit? And it was also very interesting for us because that also allowed us to find out how many asymptomatic people were actually out there. Individuals that didn't think they had the illness, and yet when we did the antibody testing, showed that they had been infected at some time in the past.
A question came in about patient finished chemotherapy in December. Would they still be part of the 1C group? And
Yeah.
so I think just defining that 1C group is just having higher risk factors, right?
Correct. So the question was, I finished my chemotherapy in December, do I still qualify for the 1C group? Yes, you are still a cancer patient. You still have the vulnerabilities, you still have the comorbidities, you still fall into that group. So certainly you should be considered in that 1C group and look for notes from your physician. So certainly should be included.
And then I think you touched on it a little bit, just about the antibodies, but how long will the vaccine be effective once I receive it? Because I think that's what we're all wondering, is this going to be a yearly thing?
Yes. So the question is, how long will the vaccine last after I got it? Is this going to be a yearly thing? Is this going to be, how often will we have to get it? And boy, I wish I had the answer. We certainly are looking into that and watching it very, very closely right now. I think what we're really hoping for is that we get long-term immunity, but until we really know, I don't think you're going to have an answer there. So will we be getting vaccinated again next year? Hopefully not, but is there a possibility? Absolutely. The good thing about that is we would probably mix it with the vaccine for influenza so that we, like now, when you take the influenza vaccine, you're actually getting vaccinated against 4 different viruses. If we were to add COVID to that, it would be 5. I think the biggest thing that we're going to, that's going to make the biggest impact on this is going to be the variants. How big are the variants? How different are they from the vaccines that we have from the virus that we're seeing right now? And do we need to have a quote-unquote booster each year for the variant that goes on? Exactly what we do with influenza. You might know that, but influenza every year, all you're getting is the variant that has happened to be the most popular in the southern hemisphere and at the end of the vaccine, at the end of the virus season each year.
I think one last question came
Sure.
in. Would a lymphoma patient in remission have as good or high of a response to the vaccine, or would the immune response be less?
The immune response in many patients, in cancer patients, whether it be leukemia or lymphoma patients, may be a little bit less. But again, let me put this back in perspective. The CDC, when we started doing vaccine studies, was willing to accept a vaccine that had a 50% efficacy rate. Fortunately, out of the box, we got Pfizer and Moderna at 90 and 94. People are looking at Johnson & Johnson saying 72. Boy, that's not as good. We have to remember the CDC was looking at 50%. And I can tell you that those who have gotten vaccinated have not gone on to be hospitalized, have not gone on to have major problems. So even though you may not get the full 94%, 2 things are going to happen. It's going to protect you from getting symptoms, and it's going to protect those around you. Okay, I think we hit the end of our time. Again, I can't thank you enough for asking me back. And like I said, please hang in there, be patient, and really take care of yourselves. You've done so well mitigating this illness so far. And I can tell you the Living Well people are so proud of what you guys are doing and how you're interacting with your peers during the virtuals. And please continue to do it because you all need each other's support at this time. And get the vaccine as quickly as you can. Sign up at your county website, sign up at the CVS's and the Walgreens, and look for a note from your doctor. Cover all your bases. You'll get the vaccine as soon as it's available. Thank you very much.